Joining us now to answer your COVID queries on this system is Dr Claire Wenham, Assistant Professor of Global Health Policy at London School of Economics, and of course our very own Dr Hilary. So we'll come to you first of all if we can, Dr Wenham, because we haven't heard from you yet this morning and we've heard from Hilary. So look, we've compiled some questions that people have put in and we've got some extra ones that have come in this morning as well. But first of all, this one we actually don't know who it's from, but the question is, I live in Tier 2 area. Can I mix in a hospitality venue with friends?
So the answer to this is basically no. What guidance says you shouldn't be mixing in a pub or a restaurant with anyone who you don't live with or who isn't in your support bubble. So maybe if you live alone and your friend forms part of your support bubble, you could, but otherwise the guidance is definitely no to this.
What do you mean by mixing? Because that's where it becomes hard, isn't it? Because it's not as though the restaurants are completely closing. For instance, could you go to a venue and be on a different table? You know, how can you make it work?
Well, I think they're trying to avoid that. I think the idea is to try and actually limit social contact. So, you know, the guidance is that if you are in a hospitality venue, you have to be sat at a table and get served at a table, and that's been in place for some time now. But the idea is you really shouldn't be trying to meet your friends. You should be, you know, calling them on Zoom and staying in your household unit to try and limit the potential risk of any disease transmission.
OK, so that's in the hospitality and in the social side of things. We've got one here. Dr Hilary, if we come to you with this one, it says, I live in Liverpool in a Tier 3 area. Can I travel to London Tier 2 area next week for work? So what about those people who are in a work situation and need to travel? What applies to them?
OK, so essential travel is allowed under the guidance. So if it's work or health related or education related, you can travel outside your area. So work from home if you possibly can is also the guidance. But if you have to go to work and you have to go to a different tier, you're not meant to stay overnight. That is discouraged. It's not banned by law, but it's discouraged. And the whole idea is that if you're in a Tier 3 area, the prevalence is higher, you're more at risk of transmitting the virus to other people, and the rules are there to protect you, not punish you.
And Dr.
Would that apply the same? Sorry, Charlotte. Would that apply the same if you live in a Tier 2 area to a Tier 1?
If you're in a Tier 2 area, if you go to a Tier 1 area, you should be following the rules of a Tier 2 area.
Right.
So you're following the rules of the higher alert area, not the lower one.
I mean, I just wondered if, in general, at the moment, would you be saying to people, look, if you don't need to do something, don't do it?
Yeah, absolutely, because the whole idea is that we're protecting people, not punishing people. People need to understand that. So the less travel there is, the less transmission between people, the better. That earlier answer, very, very good. You can mix outdoors with other households under Tier 2. You can mix outdoors with other households, but as long as it's within the rule of 6.
The problem is that's going to impact on people in certain jobs, isn't it? Because if some of the jobs involve, you know, less mixing, you no longer can work if you're having to follow the stricter rules, even though you're in an area where they're still operating. Yeah,
I mean, the rules are there for a reason.
Yeah,
so
OK.
If work means that, you know, you can't socially distance and you're not allowed to go to work, so be it.
Dr Claire, let's come to you with the next question. There's one here that says about holidays. Can I go on holiday from Tier 3 area to a Tier 1 area? If I do I follow the local rules or my home rules? Can I travel to an area with less restrictions and mix with other households? Obviously, we're coming up to half-term, aren't we? People might be wanting to get away, have a bit of a break, give themselves a bit of a light at the end of the tunnel through all this.
Yeah, and that's why it's quite sad, but the answer is basically no. The guidance now for Tier 3 is you shouldn't be leaving unless it is for work or for caring responsibilities. And so therefore going on holiday really isn't allowed. So, you know, it doesn't really matter what zone you'd be moving into. If you're in a Tier 3, you really should be staying in a Tier 3. And this is really so that you're not spreading the virus across the country to areas which might be more in control at the moment, for example.
And what about in a Tier 2?
In a Tier 2, we're also being asked to stay at home as much as possible. So I think we should really be focusing on that right now.
And who should be shielding at the moment, Dr Claire? And is it affected by what tier you're in?
So as far as I'm aware, there's no guidance currently on shielding. They're not asking particular groups to shield. I think the government is asking people who are clinically vulnerable to avoid going on public transport as much as possible, but there's no clear guidance, as far as I can see, about shielding particular groups.
And talking about getting around, Dr. Hilary, let's come to you with this one. There's a question here about travelling in a car. Can you be in a car with somebody in a different tier from you?
You can be, but it's not encouraged. First of all, remember that it's essential travel. If you can drive yourself, that's the best thing. If you can't, drive with, have a driver that is part of your household or your social or your bubble. If you can't do that, then you can sit in a car with somebody else from a different tier, but they should be wearing masks. You should be sitting as far away as possible from the driver. You should open the windows and use hand sanitisers and take every precaution you can, but it is allowable.
And does the rule of 6 still apply? Presumably it does in Tier 1.
In Tier 1, yes, the rule of 6 applies, indoors and outdoors, yeah.
OK. And a couple of other questions come in relating to parents who have children, you know, perhaps separated parents who have children that need to visit different households. So, if you live in Tier 1, can your child go and visit, in this instance, their dad in Tier 2 or 3?
Are you asking me?
Yes, sorry, Hilary. Let's ask you first, yeah.
OK, so in Tier 1 you can, because 6 people from different households can mix indoors or outdoors. So in Tier 2, my understanding would be that if the other parent with children under 18 is part of that support bubble, then that's still permissible. But if not, in Tier 2 and 3, if it's a different household, and that's where people live most of the time, then it's not permitted to meet up indoors. And remember, this regional lockdown would be for a temporary period, so it's not the end of the world.
I've got one here about medical appointments. I know you did touch on this earlier, but Ben says, I live in Lancashire, but have a non-emergency hospital appointment in Manchester. Should I go or should I cancel? And we've got this news today, haven't we, about the number of GP appointments. More than 25 million GP appointments have been lost because of the pandemic. There is this real worry about people not going to appointments. It's important at the moment, isn't it, for other things like whether it's, you know, cancer or any other kind of disease that people are going.
Yes, it's a real worry that the NHS is meant to be open for business, so anyone's got an emergency appointment, they need to go. You know, those areas will be COVID secure as much as is practically possible, which is very good. So if you've got any worries about emergency care, heart disease, chest pain, anything like that, or you're worried about symptoms that might be cancer, then call your GP and go along to your appointment. It's really important to do that.
And Dr Claire, coming to you on this whole basis that we're living under at the moment, this 3-tier system. I mean, we're seeing sort of half the population under restrictions at the moment. Does this work, do you think, or should we be going into a national lockdown? Should we face the fact that maybe we need this circuit breaker to reset things for a time?
I think the bigger question is, what are we trying to get to, right? Are we trying to get to completely, you know, what's the purpose of this process? Is it about completely halting the virus? Or is it trying to just be able to manage the virus and make sure health systems don't get overwhelmed? They're a bit different. I think the idea of moving to a 3-tier system was really to simplify it, because there was a lot of mixed guidance about different postcodes previously. So the idea is that this is supposed to simplify it. And I understand that it's still quite complicated, particularly, you know, given the questions we've talked about. But we're really hoping that with these steps in place, it might be enough to mean that we don't need to have another lockdown. Nobody wants another lockdown. But we also need to make sure we are protecting our population and the people who are most at risk in our population. So we've got to just weigh up all those pros and cons.
Very interesting. Well, listen, you've both been very clear, and we've been asking you in a Twitter poll if you fully understand the coronavirus rules in your area. More than 12,000 of you have voted our poll. 49% of you say yes. 51 of you say no. I mean, that is a big majority of people.
So more than half of people don't understand the restrictions.
But I'm surprised, actually, that nearly half also do. I mean, it shows that, actually, the message is getting through. We should probably do that poll again now, shouldn't we, after you two have explained it? Because I'm sure it would shift to a lot more people understand it. Thanks very much indeed to both of you.